If you're up at 3 a.m. wondering if you're making enough milk for your baby, take a deep breath. You are not alone. Low milk supply is the #1 concern new breastfeeding moms have. But here's what most people won't tell you. Only about 5% of women truly can't produce enough milk. For the rest of us, it's either fixable or your body is actually doing better than you think. Let me walk you through everything week by week. Your breasts work on a simple principle. The more milk that's removed, the more your body makes. Every time your baby feeds or you pump, your body gets the signal to produce more. Skip a feed, and your body thinks it should slow down. 2 hormones run the show. Prolactin tells your body to make milk, and it's highest between 2 and 5 a.m. Yes, those night feeds actually matter more than you think. Oxytocin triggers the letdown reflex. Skin-to-skin contact, looking at your baby, even hearing your baby cry can trigger it. Here's something that calms a lot of new moms. Your newborn stomach is tiny. On day 1, it's the size of a cherry and holds just 5 to 7 milliliters. By day 3, it's a walnut, about 22 milliliters. By week 1, it's an apricot, around 45 to 60 milliliters. Those small amounts of colostrum you're producing, they're exactly what your baby needs. Don't let anyone tell you otherwise. Week 1 is all about frequency. Feed 8 to 12 times in 24 hours. That's almost every 2 hours, and yes, around the clock. Take advantage of the golden hour right after birth for immediate skin-to-skin. Watch your baby for feeding cues like rooting, lip smacking, and hands to mouth. And please don't panic about small amounts. Colostrum is concentrated liquid gold. A little goes a very long way. Around day 3 to 5, your milk transitions and your breasts will feel dramatically different. Keep feeding on demand. If you're engorged, hand express just enough for comfort, but don't fully empty because that signals overproduction. Start tracking wet and dirty diapers. By end of week 2, your baby should have 6 or more wet diapers and 3 to 4 yellow stools per day. Weight loss should stop and baby starts gaining. By week 3, you're starting to figure each other out. Cluster feeding in the evenings is completely normal. It does not mean your supply is low. This is also a common growth spurt period, so baby may seem hungrier than usual. And here's something important. Your breasts may start feeling softer. This is not low supply. It's your body becoming more efficient at making milk on demand. Week 4 is when your body calibrates to your baby's exact needs. Trust the process. Softer breasts really do not mean less milk. Your baby should be gaining 5 to 7 ounces per week. Feeding sessions may get shorter as your baby becomes more efficient. If you're planning to return to work, this is a good time to introduce one pumping session to start a small stash. Now let me share 12 proven ways to increase your milk supply. These are based on evidence and real experience from thousands of breastfeeding mothers. Tips 1 and 2. Feed more frequently and get the latch right. Adding just 1 or 2 extra feeds per day can make a big difference. And don't skip night feeds. Prolactin peaks between 2 and 5 a.m., making those miserable middle-of-the-night feeds your most productive ones. For the latch, baby's mouth should cover most of the areola. You should hear swallowing, and it shouldn't hurt after the first 30 seconds. If it's painful, see a lactation consultant. One session can change everything. Tip 3. Power pumping. This mimics cluster feeding to tell your body to ramp up production. Here's the schedule. Pump for 20 minutes, rest 10, pump 10, rest 10, pump 10 more. Do this once a day, evening is best. Most moms see results within 48 to 72 hours. It sounds exhausting, but it really works. Tips 4 and 5. Skin-to-skin contact triggers oxytocin, which triggers letdown, which signals more production. Do it outside of feeding times too. For nutrition, you need about 500 extra calories a day. Foods linked to milk production include oats, flaxseed, brewer's yeast, fennel, and dark leafy greens. And drink, drink, drink. Aim for 100 ounces of water daily. Keep a water bottle at every nursing station. Tip 6, and this is a big one. Stress directly lowers your milk supply. It's not just fluffy advice. Cortisol, the stress hormone, actually suppresses prolactin, the milk-making hormone. When you're anxious about supply, you might be making less milk because of that anxiety. Try box breathing before nursing. Put your phone away during feeds, and ask your partner for specific help, not just be supportive, but actual tasks. Tip 7, and nobody talks about this enough. Nipple pain is one of the biggest hidden causes of low milk supply. Here's how it works. Sore, cracked nipples make you dread feeding. You start spacing out feeds because it hurts too much. Your body thinks make less milk, and your supply drops. 79% of moms experience nipple pain in the first week, and 30% stop breastfeeding within 12 weeks because of it. Silver nursing cups can help break this cycle. They sit inside your bra and use your own breast milk plus Silver's natural healing properties to heal cracked nipples between feeds. Unlike creams, you don't need to wash them off before nursing. A few more important tips. Switch sides 2 to 3 times during each feed to keep baby actively sucking. Avoid pacifiers and bottles in the first 3 to 4 weeks while supply establishes. Use breast compression during feeds to help baby get more hind milk. If nothing is working, ask your doctor to check for tongue tie, thyroid issues, or PCOS. And know when to see an IBCLC, a board-certified lactation consultant, especially if baby hasn't regained birth weight by 2 weeks. Let's talk about something nobody connects. Anxiety about supply can actually lower supply. Worry leads to cortisol. Cortisol suppresses prolactin, supply dips, and you worry more. It's a cruel cycle. Focus on diaper output, not pump output. Stay off breastfeeding forums at 3 a.m. Talk to someone about how you're feeling. And remember, supplementing with formula is not failure. Fed is best. Always. Let me bust 5 common myths. Soft breasts don't mean low supply, it means your body is efficient. Pump output is not what baby gets, babies are much better than pumps. Small breasts don't make less milk, size is fat tissue, not glandular tissue. You don't need to drink milk to make milk. And if baby wants to feed 30 minutes after eating, that's cluster feeding, not low supply. It's actually boosting your supply for tomorrow. Partners, here are actual things you can do. Bring water and a snack to every feed. Handle burping and diaper changes after feeds. Protect the night feed schedule, don't suggest skipping them. Learn hunger cues and bring baby to mom before full crying. Be the gatekeeper with visitors and household tasks. And advocate at doctor visits if something seems off with the latch. You're doing better than you think. Whether it's 100% breast milk, a combination, or eventually formula, you're a great mother for showing up and trying. Visit MOOGCObaby.com for silver nursing cups to protect your breastfeeding journey and bamboo sleep sacks for better rest between feeds. Drop the word baby in the comments for $10 off orders over $100. Subscribe and hit the bell for more parenting guides. You've got this.